Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Welcome back here at our weekly talk here at Casey's Holistic Health. So this afternoon we'll be discussing about what we call low-level light therapy. Okay, so what is low-level light therapy? Actually, it's therapy wherein we actually use light. No, so that's why it's called light therapy. So there are two kinds of light that we use as therapy. So it could be from lasers or what we call the LED or light emitting diodes, no? So as a background, we've been using sunlight, right? We've been using sunlight as a form of treatment, even as early as during the Egyptian times, when the doctors would diagnose their patients back then with some form of mental condition, they usually would ask them to go out into the sun as a form of treatment. So treatment using the sun is not a new thing. In fact, as early as the 1900s, early 1900s, wherein there was still no antibiotics, during the early 1900s, and when people were diagnosed with tuberculosis, Europe had this what they called solariums, so solariums are like hospitals, only that it's called solarium because solar from sun. So what they do, they put the patients out into the balcony. The beds are actually in the balcony, and then, the patients are all naked, bathing in the sun. So they call it solarium. So usually they put patients here in the solariums because they have to stay there for months. They have to have sunlight every single day for the next few months because they had tuberculosis, and back then antibiotics as a form of treatment for tuberculosis, as you might not know, in the early times, a lot of people actually die of tuberculosis. So they call this consumption disease, meaning because you literally become consumed with the disease, wherein you start losing weight, losing all the muscles, until one day, you just die from the disease, So it was a serious illness back then. So, and it's still a serious illness now because a lot of people, especially Filipinos, have what we call multiple drug-resistant tuberculosis. So I think we also have to reintroduce this light therapy again. It could be the sun. So the sun has, as you might know, the sun has several wavelengths, meaning light or colors of light. So there are colors of the rainbow. You have the red, orange, green, yellow, blue, indigo. So all these different wavelengths, they found that have different characteristics or different benefits, So the first light that was really used in treatment was the red wavelength, so red light, So they found out that when you give red light therapy, whether it's in the form of lasers or what we call LED, it increases the healing properties. Okay, so they found out those who had skin ulcers, they put red light, the wound heal faster, or their hair grows even faster also. So they found out that red light seems to be a very good regenerator or improves wound healing. So that's how red light therapy started. So the red light therapy is, of course, the beginning was using it as a form of a topical, meaning you're just putting light onto the skin, right? So later on, the Russians, the Russians who started thinking, why don't we introduce the light into our veins or into our blood vessels? So during early 70s and 80s, they started doing this. They're using light as a form of treating diseases, okay? But only it's intravenous. So usually when we say intravenous, the light is introduced through the veins. And usually the form of treatment they use is what we call laser. So the reason they call it low-level laser is, as you might know, diba, or what you ordinarily know, yung lasers that are used in medicine as well as in military applications. These are what we call high-powered lasers, So they could be from 100 milliwatts to, hundreds of watts. So when we say low-level light therapy, which is what you use for IV, usually it's around 2 to 5 milliwatts. Very, very small. It's like, your laser pointer. These are red form of laser, So these are like, less than 1 milliwatt. So it's also it does have an effect also. So going back, so when we say low level light, the amount of radiation or amount of light that you're using is very, very small. It's only about 2 to 5 milliwatts. So there's no heat, there's no burning. It only irradiates, or what we call shines, the red light into your blood. So what happens when it shines into the blood? Then they notice, that when you use the red light on the IV on your veins, they improves your blood circulation. It increases your oxygen capacity of your red blood cells. It also is it seems to help in increasing your stem cells. So they found out, these IV lasers or low-level laser therapies seem to work in increasing also your stem cells. So aside from the red lasers, because the laser therapy or the topical lasers, it's really a big topic. So we're just going to talk about the IV lasers. So the IV lasers is they have many colors. You can use the red, the blue, the yellow, the green, the UV. So all these colors also have different properties. Like yellow is very good for patients who have depression, anxiety. The blue is antibacterial, the UV is antibacterial as well as anti-cancer. You have the green, helps with the red laser in improving blood circulation. So also they found out when you do more frequent IV lasers or low-level lasers, it also improves a lot of these different diseases. Maybe it's because it increases blood circulation, a combination of increasing blood circulation, also because improves your white blood cells, as well as increases your stem cells. So these are maybe I would say some of the effects that are generated by using low-level laser therapy, because they found out that when you do regularly, their diseases becomes seems to be better. Especially those we do see a lot of patients who have what we call peripheral arterial disease. Peripheral arterial disease meaning yung blood vessels nila in their legs are very bad, to the point na pangit yung circulation ng dugo. You see a lot of them in yung mga diabetic, they have diabetic foot, they have poor blood circulations in their lower legs, nagkakaroon sila ng ulcer, ulceration ng legs or ng paa, So if you do frequent IV lasers, it seems to improve the wound heals very, very fast, and we've seen this a lot of times in a lot of patients. So we really know that low-level laser therapy really, really works. So the therapy usually would last from 5, 10 to 30 minutes. But we cannot go beyond 30 minutes because there's also a matter of dose. If you increase, our thinking is if you increase the number of minutes, then you'll be more effective. Actually, they found that the opposite. If you do it too long, actually it becomes the effect is lost, and then then you become worse rather than getting better. So usually low-level laser therapy or low-level light therapy is science wherein there's still a lot of things to find out how it works, but we do know it works. A lot of studies now showing that low-level laser therapy really helps even in those who had stroke, to those who have heart disease. Okay, if you have what we call angina, it seems to help also. We've seen a lot of patients who have had chest pain, angina, because of blocked arteries in the heart. So because they were refusing to do open heart surgery, so we did recommend IV laser therapy. So this seems to help because the angina slowly went away. They can function normally. So we pretty much are very confident with our using laser therapy as a form of treating these arterial or what we call blood vessel problems or blood circulation problems. Okay? Now I will read some questions from our listeners and answer them in this segment. Which is more effective, IV laser or ozone? It depends. There's no which one is better. It really depends on the patient, on the condition that you want to treat. Okay. Same with ozone and hydrogen peroxide. Again, it's a matter of the disease as well as the condition of the patient. No. How long is too long? Well, I guess if you go beyond 45 minutes, that would be too long. Okay. Recurrent tonsillitis, I think you have to treat the tonsils. Okay, so maybe you could do oral or nebulization with hydrogen peroxide. I think that would be easier to do for the patients at home if they have recurrent tonsillitis. No. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.